Good afternoon, everyone. Thank you for joining the Project Echo Diabetes information session today. We'll give everybody a few more minutes to join and we'll begin the presentation shortly. Good afternoon, everyone. I see a couple more folks jumping in. Thank you for joining the Project Echo Diabetes information session today. We'll begin shortly. We're just going to let other people hop in. Good afternoon, everybody. Thank you for joining the Project Echo Diabetes information session. We will give everyone an additional 2 minutes so they can hop in the call and we begin the presentation shortly. Good afternoon, everyone. Thank you for being on time for the Project Echo Diabetes information session. I do still see a lot of people jumping in, so we're going to give it one more minute to give them a chance to hop in. All right, good afternoon, everybody, and thank you for joining us in the Health Choice Network's Project Echo Diabetes information session. We are excited to have you all here today and look forward to engaging many of you in this project. Today, we will present a very high-level overview of the Diabetes Echo program in an effort to recruit 10 HCN Florida Health Center clinic sites. This information session will be followed by one more detailed one-on-one discussion with those who express interest in the program. For those interested, the University of Florida Diabetes Institute will schedule a lunch and learn session at your earliest convenience. In today's agenda, we will cover a brief history of the ECHO model, its goals and benefits at the community health center level and at the community level. We will then go over the pilot program or phase 1 of ECHO, where we will discuss the findings and the lessons learned. Then we will cover some ground rules, including the participation in ECHO clinics and data collection requirements from your health center. We will then talk about expansion into phase 2 of diabetes ECHO, where we are including insulin requiring type 2 diabetes. We will also discuss the research design and some timeline due dates and important dates. Finally, for next steps, we will have Dr. Ashby Walker from the University of Florida Diabetes Institute discuss the lunch and learn session, and we will have a discussion and question and answer session at the end as well. I'll begin by introducing myself. My name is Diana Chavez. I am a certified medical assistant, currently pursuing a Master's of Business Administration degree with a focus of healthcare at Florida International University. And I am proud to serve as the Diabetes Program Coordinator at HCN since February of this year. Prior to HCN, I worked at FIU as a Clinical Research Coordinator for the School of Public Health, and I have 6 years of experience at clinical settings, including primary care. So this is the entire Project Echo Diabetes leadership team. At UF, we have, and here on the line today actually, we have Dr. Ashby Walker and Dr. Michael Haller. At Stanford University, we have Dr. Davis Maas and Dr. Nicolas Cutris. And here at HCN, we have, as everybody knows, Meredith March and Dr. Tim Long. So what is Project Echo? A lot of you are familiar with the model, but we are going to give a brief overview for those of you who do not. So many of you have heard some portions of this presentation at several HCN meetings and work groups, but we'll discuss again briefly. We're excited to announce that HCN has partnered with the University of Florida Diabetes Institute and with funding from the Helmsley Charitable Trust to offer Florida community health centers the opportunity to participate in Project Echo Diabetes. Project Echo uses the expansion for community healthcare outcomes model with the goal to empower primary care providers in managing adults and pediatric patients living with type 1 and type 2 diabetes who require multiple insulin injections and who lack access to routine specialty care in underserved communities. The Echo Diabetes Project partners with primary care providers and federally qualified healthcare centers to evaluate the impacts and outcomes of this educational and outreach model. The ECHO model stands in 4 pillars. The first is amplification, which is the use of technology to leverage scarce resources. The second is best practices, which focuses on sharing best practices to reduce disparities. The third is case-based learning, which uses this model to master management of complex clinical cases. And the fourth is database, which is the use of web-based data to monitor health outcomes. And the ECHO mission is to democratize the medical knowledge and get best practice care to underserved people all over the world. So here is a bit of history behind Project ECHO. The model was actually founded in 2004 by Dr. Sanjeev Arora to address hepatitis C virus in New Mexico. The heart of the ECHO model is its hub and spoke knowledge sharing network. The hub in this partnership is the University of Florida Diabetes Institute, and the spokes are each individual clinic sites from each participating health center that we will be recruiting today. Project ECHO is led by expert teams who are multi-point video conferencing to conduct virtual clinics with community providers. Primary care providers such as doctors, nurses, and other clinicians, including medical assistants, learn to provide excellent specialty care to patients in their own communities. The ECHO model has been adopted and applied in over 20 different specialties in over 50 institutions globally. So needless to say, the ECHO model has proven that it's very successful. This is a high-level visual of Project ECHO, of what Project ECHO is all about. As you know, the hub is UFDI, and the hub provides education, real-time support, diabetes support coaches, and access to an online repository of diabetes education learning modules to primary care providers at each participating spoke in order to empower them in managing diabetic patients. Tele-ECHO is not the same as telemedicine. Traditional telemedicine involves direct patient-to-provider care, while Tele-ECHO connects a group of experts to primary care providers who are then empowered and more confident to share the knowledge with their clinical team and to manage complex cases of diabetic patients. This map shows the many Project ECHO hubs and super hubs around the United States. However, notice that as of 2017, Florida did not have any ECHO hubs or super hubs. Hubs are force multipliers that train multiple spokes, and if very successful, they become super hubs to help other centers become hubs themselves. In 2018, the University of Florida Diabetes Institute and Stanford University launched the first ECHO Type 1 diabetes program in the U.S. and the first officially recognized Project ECHO in the state of Florida. And this was made possible with funding from the Helmsley Charitable Trust. So we talked about the Project ECHO model and reviewed some of its history. But why should you be interested? Project ECHO has benefits at the community health center level and at the community level. Benefits at the community health center level include knowledge. Participating clinical staff will have access to resources on best practices, new diabetes treatments, and technology. Providers will receive education through tele-ECHO clinics and virtual trainings. Participating clinicians will have the opportunity to receive CME credits for participating in the weekly 1-hour-long ECHO clinics. Not to mention UFDI is now offering maintenance of certification that are known as MOC Part 2, which is a lifelong learning credit, and also MOC Part 4 that focuses on patient engagement efforts via QI projects. When it comes to management, clinicians will have real-time provider assistance with challenging medical decision-making issues and healthcare navigation through the support of a multidisciplinary team of diabetes professionals. Financially, participating health centers will receive stipends of up to $10,000 for each year participating in ECHO diabetes. The 4 current HCN centers participating in ECHO diabetes are receiving stipends anywhere from $15,000 to $25,000 to support patients with diabetes through COVID-19. And this was made possible through the efforts of UFDI in acquiring grants for our health centers. Lastly, but definitely not least, when it comes to UDS measures, echo diabetes can assist in improving diabetes pore control at the health center level by providing support and knowledge of use of technologies such as CGM and insulin pumps. And of course, the benefit of social support from the diabetes support coaches. Benefits at the community level are also incredibly important. Patients will have access to new treatments, improved care, and enhanced monitoring of outcomes. Patients can benefit from the connection they make with diabetes support coaches that are assigned to each clinic and that provide support and help bridge providers to hubs and patients to providers. We will discuss them in detail because this is a very important aspect of the Diabetes Echo project. Lastly, when it comes to research, patients are eligible for enrollment in research projects at the U.S. Diabetes Institute. Stipends for each survey completed while participating in ECHO are also issued to participants. So let's discuss diabetes supports a little further because, like I said, this is a very important aspect of this particular ECHO project. Meet the diabetes support coaches of Florida. They are hired to provide peer support for type 1 and type 2 diabetes patients at the HCN centers. They organize social events, provide one-on-one peer coaching, and develop local resource guides for participating health centers. Many of you have had the pleasure of working with these coaches already, and let me tell you, I sit in the weekly support coach meetings and can attest to their dedication and passion toward helping both the patients and the providers they work with. So how can providers utilize the expertise of diabetes support coaches? Coaches are hired and trained by U.S. ECHO program to provide support to patients at participating spoke sites. Coaches either live with diabetes themselves or with someone who is living with diabetes. So they know firsthand what patients may need or the support that they require to manage their disease. They also organize and gather resources for diabetic patients at your health center. And through their training, they are equipped to provide support to patients on multiple daily injections or insulin pumps. They can also support patients who take insulin at least once a day. Diabetes support coaches' work can be tailored to the spoke site's needs with the approval of ECHO Diabetes leadership. So this is not all that they do, but these are some of the important aspects of the support coaches. It is very important, and the U.S. ECHO team wanted me to reiterate that support coaches do not give direct medical advice. This is not part of what they do. Here's the list of the do's and don'ts of diabetes support coaches. Some of the do's include reminders to patients of upcoming clinic appointments, listening to patients' diabetes stories, and invitations to social events, among others. Coaches cannot, however, again, give direct medical advice to patients. They cannot adjust a patient's insulin doses. They cannot diagnose a patient or prescribe medication. And they cannot work on one-on-one patients who do not require insulin. This is also not an exhaustive list of the do's, and again, other activities may be performed with the approval of the ECHO leadership team. So these are only two examples of the social events that were regularly planned by the diabetes support coaches prior to COVID pandemic. Currently, however, coaches are hosting remote town hall meetings in Spanish and English to replace these gatherings. And this is an example of the resource guides that are gathered and disseminated by support coaches at the participating spokes. They include information about free or discounted medical services or supplies, free or discounted clinics for diabetes services or behavioral health services, and other resources for social support, fitness, and nutritional needs even. So now let's look back at the ECHO pilot program and the lessons we learned from them. The Diabetes ECHO pilot program was a survey research conducted with 123 primary care providers in Florida and California using a convenient sample. Publicly available directories from primary care providers in Florida and California were used to mail out surveys with postage-paid returned envelopes for their answers. Family medicine departments and other primary care locations were sent REDCap survey links. For those of you who are not familiar, REDCap is a secure web application used to build online surveys and databases for research. The pilot program was aiming to understand the care delivery protocols for children and adults living with type 1 diabetes in the primary care setting. It assessed the confidence of primary care providers in delivering type 1 diabetes care and the documented barriers that primary care providers had in delivering that care. So, as we said, the surveyed primary care providers demonstrated low levels of confidence in providing type 1 diabetes, and these are just 5 of the findings that they discovered, but there were many more. So, like I said, primary care providers demonstrated that they had low confidence in providing type 1 diabetes care, especially related to diabetes technologies like the CGMs and the insulin pumps. Despite the lack of confidence of type 1 diabetes care, though, primary care providers were reporting that they were filling insulin prescriptions and needed more resources to support the type 1 diabetes patients. Pre- and post-test surveys with participating providers demonstrated statistically significant improvements in type 1 diabetes knowledge and confidence, though. Another finding was that neighborhood deprivation index was used in conjunction with geocoding of primary care providers and endocrinologists in both Florida and California to concurrently identify areas with low endocrinology provider density and high health risk poverty areas. In Florida, 26 counties were identified as high-need catchment areas, and in California, 30 were identified for ECHO type 1 diabetes spoke recruitment. There were also focus groups that were set up for the pilot program, and they were conducted with 86 high-need, high-cost adults with type 1 diabetes. This pioneering study showed that adult communities with type 1 diabetes face many challenges in receiving care. Some of these include limited access to medical supplies, limited access to new technologies, lack of well-rounded care team that included dietitians and trainers, lack of empathetic providers, and the lack of research in type 1 diabetes care, as well as limited social support systems. Enrollment in the pilot program demonstrated extremely high interest amongst primary care providers as the pilot program filled beyond capacity. In Florida, 12 spoke sites enrolled in 67 clinics who served over 1,000 patients with type 1 diabetes. In California, 11 spoke sites enrolled with 37 clinics serving roughly 900 adults and pediatric patients with type 1 diabetes who did not receive specialty type 1 diabetes care. Evaluation of the spoke experience with ECHO type 1 pilot through CME evaluation and exit focus groups also demonstrated high satisfaction with the program, improved competencies related to type 1 diabetes care, and changes in care related to type 1 diabetes patients. In phase 2 of ECHO now, patient level, provider level, and system level outcomes will be rigorously evaluated so that we can continue to prove that the ECHO model is not only successful, but it has long-lasting effects in the community. These were some of the reported barriers from the pilot program as well. Reported barriers included easier access to primary care providers than specialists. 30% of participating providers reported lack of endocrinologists in their geographical area, and providers reported long wait times when getting patients to endocrinologists. Lack of diabetes education resources was also reported for diabetes care, behavioral health, and information about diabetes care technologies, again, CGMs and insulin pumps. And of course, all of this leads to suboptimal diabetes care. So in summary, the ECHO pilot program taught us that primary care providers lack confidence in providing type 1 diabetes care, especially related to diabetes technologies. It also taught us that protocols for type 1 diabetes care in primary care settings need improvement, including consistent HbA1c monitoring, providing basic type 1 diabetes education, screening for comorbidities, and incorporating protocols for CGM and insulin pumps is prescribed. Lastly, it taught us that developing interventions to improve health outcomes in type 1 diabetes must include targeting primary care settings and primary care providers. So this is a visual overview of another very important finding from the pilot program at the provider level. As you can see, pre and post testing of providers showed that their knowledge in diabetes care and confidence levels for that delivery of care was significantly improved after participating in the ECHO program. And this is something that the team at UF is extremely proud about. So ECHO ground rules. So far, we have defined the ECHO program, we have outlined its goals and benefits, and we discussed findings from the pilot program. Now, let's review some ground rules for participating in the ECHO program if interested. A very important aspect of ECHO is the tele-ECHO Zoom clinics for provider education. These dedicated hour-long weekly telemonitoring clinics are designed for primary care providers and other clinicians at your clinic site to present challenging cases for recommendations to a multidisciplinary team. This team includes behavioral health specialists, pharmacists, community health workers, social workers, adult and pediatric endocrinologists, you name it. The structure of the series is as follows. For the first 6 months, Zoom clinics occur on a weekly basis on Thursdays from 12 p.m. to 1 p.m. Eastern Standard Time. After those first 6 months, clinics occur in a bi-weekly basis on Thursdays from 12 to 1 p.m. Each of these sessions include a portion of diabetes-related didactics that last about 20 to 30 minutes, followed by presentations and discussions of the identified patient cases that also last about 20 minutes, and then finally a general questions and answers or discussion session that lasts another 10 to 20 minutes. After each clinic, written recommendations of patient case discussions are provided for patients to follow up and reference that you might have later on. So didactic presentation topics vary on a weekly basis. Here are some of the topics covered in prior Zoom clinics. In addition to these, since the beginning of March, UF actually adapted Zoom clinics to cover COVID-related topics as well. And related to the pandemic, Stanford has also offered a COVID webinar series to all health centers participating in ECHO program that focuses more on the treatment of diabetes patients in the time of COVID. So participating health centers are actually encouraged by the ECHO team to get other clinical staff involved in the tele-ECHO clinics, assigning them to participate in the clinic and later disseminating the lessons learned to the rest of the staff. Clinicians who participate in tele-ECHO clinics are eligible to obtain continued education credits, including MOC Part 2 and MOC Part 4. MOC Part 2 provides lifelong learning credits for American Board of Pediatrics and American Board of Internal Medicine, and this is offered for MDs only. MOC Part 4 focuses on quality engagement improvements, and I'll let Dr. Ashby Walker talk a little more during her section about these two different credits. USDI is currently working on getting continuing education credits for nurses and pharmacists who participate in tele-ECHO clinics as well. So what's next? Here at HCN, we are thrilled to be part of Diabetes ECHO expansion into phase 2, and this is actually where you come in. In June of 2019, the Helmsley Charitable Trust awarded UF and Stanford a $7.69 million 3-year grant to expand the ECHO Type 1 diabetes program to additional locations in Florida and California, and to evaluate outcomes of the program on patient, provider, and system level. As you may have noticed, the pilot program was really focused on type 1 diabetes patients. However, the expansion of ECHO program will include the additional focus of type 2 diabetes patients who are insulin requiring. So again, this is where you come in. The collaboration with HCN will allow us to recruit 10 Florida clinic sites from our network to participate in this very exclusive program. So let's talk now about the research design and dive into the data requirements. Diabetes Echo has a step wedge design. For those not familiar with this design, it is a cluster randomized controlled research design which is structured to reduce bias when testing new medical treatments or social interventions. It involves random and sequential crossover of clusters from control to intervention until all clusters are exposed. We will review diabetes echo clusters, or cohorts as we will know them, in the next slides. When it comes to data, and as mentioned before, the expansion of the project will evaluate outcomes on the patient, provider, and system level. At the patient and provider level, peer coaches will collect the required data using REDCap software. At the provider level, these data include pre- and post-echo knowledge and competence assessments and the CME evaluations. At the patient level, these will include pre- and post outcomes of HbA1c, diabetes distress, diabetic ketoacidosis, and provider trust. At the spoke level, Diane Cardenas, which some of you may have met, our HCN data analyst, in collaboration with UFDI, has developed a data dictionary for ECHO to allow us to collect the required data at baseline, at 12 months, and every year thereafter for the next 3 years of the grant. The data collected during phase 2 will hopefully be used to convince payers, state and federal governments, and other important stakeholders that ECHO does help to improve patient outcomes. So currently there are 3 participating health centers at HCN, and those are Jesse Trice Community Health Centers, Miami Beach Community Health Centers, and Community Health Centers of Pinellas. Great, so we have provided a high-level overview of what diabetes echo is all about, but we also want to discuss important dates that you may want to consider if interested in participating. Our efforts begin with recruitment, which starts with this information session. So you made it to the first step. We have 10 spots available for 10 clinic sites that are interested in participating. Because of the step wedge design, UF will randomize these 10 sites into 2 cohorts made up of 5 clinic sites or spokes. Depending on what cohort your spoke is assigned to, dates for orientation will vary. Cohort 1 kicks off with orientation on February of next year, while Cohort 2 will have a 6-month delay and kick off in August of 2021. For the pilot program, UF had all participating spokes travel to UF, but because of COVID, UF has adjusted this orientation into a dynamic virtual orientation whose date is actually still pending, but we know that it's early February and sometime in August. So again, because of the current pandemic, dates for the ECHO project have changed and are still subject to adjustment. Currently, this is what our timeline looks like. So currently we are at the recruitment stage. 10 spokes will sign up or will be interested in signing up, and they will be randomized into 2 groups of 5, which we are calling cohorts. Baseline data will be collected by the end of January of next year, and then cohort 1 will begin in February 2021, while cohort 2 will have a delay of the 6 months and begin their echo-related activities in August 2021. And then, as you can see too, the red stars indicate the participant surveys and HbA1c collections at baseline, 6 months, and 12 months of the first year. And the purple stars indicate the participants' health coach and mentee surveys that will be collected at baseline and at 12 months. Here's another visual of some important dates. So again, baseline data will be collected from all existing and new spokes by the end of January of 2021. and existing spokes will continue attending the tele-echo clinics twice monthly. Cohort 1 will kick off on February of 2021, specific dates still to be determined, and will begin attending the tele-echo clinic on a weekly basis for the first 6 months, and then twice per month thereafter. Cohort 2 will again kick off on August of 2021, and will begin attending the tele-echo clinics on a weekly basis for the first 6 months, and then twice a month thereafter. So let's talk about commitments. We also wanted to outline some specific commitments required by all participating spokes. All participating health centers must attend the tele-echo clinic. These, again, occur on a weekly basis during the first 6 months, and then twice a month thereafter. And they all occur on Thursdays from 12 p.m. to 1 p.m. Eastern Standard Time. Participating health centers must participate in unidentified case presentations. This is a requirement in order to engage you. Participating providers must fill out the provider level survey. It must be completed by participating providers in a timely manner. Surveys are collected by the diabetes support coaches or research coordinators from US. Spokes must also agree to share their data. At the spoke level, data is reported by HCN to remove the burden at the clinic level. And then 15 patients will be assessed for the patient level data at each spoke, and providers must help with identification of participating patients. Again, more details will be discussed during the one-on-one meeting with Dr. Walker after this presentation and during that lunch and learn session. But again, when it comes to sharing data at the spoke level, HCN will take care of collecting that data and reporting it out. But at the patient level, you must help identify those 15 patients that will be followed by the coaches. And then lastly, provider support for support coach efforts. And I know that sounds a little wordy, but basically we need providers to encourage patients to participate in all the events developed by the peer coaches, because this is what's going to provide that social support that patients really need in order to improve their care. Participating health centers have had success with the implementation of rotating schedules for clinical staff attending and presenting in echo clinics. Those in attendance can then disseminate the information learned to the rest of the staff, and that removes a lot of burden to all the providers at the health center level. Tele-echo presentations are also recorded for future access and can also be shared with your team if needed. Great, so that brings me to the presentation of the ECHO team. I'm going to let Dr. Ashby Walker, who is the Diabetes ECHO Project Director, and Dr. Michael Haller, who is the Diabetes ECHO Medical Director, tell you about next steps and lunch and learn. Dr. Walker, can you hear us?
Yes, absolutely. And we're also joined by Dr. Haller as well. And that was an excellent presentation, and we thank you so much for that. And you know, you've been given such a good overview about echo diabetes, and what we want you to know is this really is a tremendous resource and a platform that we have in the state of Florida, and federally qualified healthcare facilities are the perfect place to really engage an ECHO program. And if you are listening to this and you're interested in learning more, the next steps will be for our team to set up an individual lunch and learn at your health center. Pre-COVID, we would have come directly to your health center and provided lunch, but it's going to be virtual this time. We will still provide lunch. We'll deliver it to wherever you are, but it's a really important first step in getting to know our team here at UF, our multidisciplinary team, and also for us to get to know you and your needs, because we recognize that health centers' needs are each unique. So what we would like to do is to be able to open this up for questions, and I will need to defer to the presentation panel here because I don't know how Q&A works if people can unmute themselves. But Dr. Haller and I are happy to answer your question, any questions. And this really is a powerful resource for provider education, and then the additional diabetes support coach support for your communities who live with diabetes. I want to emphasize again that this was piloted in type 1, but we are expanding now to include your adult patients who live with type 2 diabetes who require multiple daily injections of insulin. So this really is not an ECHO type 1 diabetes. We've rebranded it as ECHO diabetes. And Dr. Haller, is there anything else you would like to add before we open it up to questions?
I would just add that I've been so impressed by this collaboration with HCN. Thank you, Diana, and your team. And to say that the changes that I've seen as a physician taking care of folks with diabetes for the last 20 years because of the access to ECHO has been nothing short of remarkable. We're seeing patients who we historically just don't reach and who don't achieve targets having dramatic improvements in their very short-term and hopefully long-term measurable outcomes. So I hope you will very seriously consider participating. I think it's an incredibly useful model and one that we hope through this effort we can prove to the payers that's worth continuing in many other venues. So come along, join us on this exciting opportunity, and we'll be here to support you.
Diana, I don't see anything in the chat right now, but we can definitely unmute all the attendees if they'd like.
Yes, please, this is your time. We have two very, very wise people here. So if you have any questions about the ECHO project at all.
What percentage of providers do you anticipate or need to be involved?
Well, our goal for this expansion is to have 10 new health centers join. So we currently in the state of Florida have 7 health centers participating. We want to add 10 more. Now, in what we call a spoke, which is a health center, I think you're raising a good question. So how many providers from that health center need to participate? Ideally, you want widespread participation in our teleeducation sessions where we're training the PCPs. What we've seen work the most effectively, I'll give a shout out to Community Health Centers of Pinellas. They have a rotating list and they rotate their providers. So there's always somebody representing their health center on our ECHO calls. And then whoever represented them disseminates that information in staff meetings back to their colleagues. So we recognize that it would be a lot for providers to attend every single week for the first 6 months and then twice a month thereafter. So what we would suggest and highlight as best practices from Community Health Centers of Pinellas is just having a rotating schedule. So as many of your providers can join and benefit from these education sessions that we have on Thursdays. I also want to note that they are recorded. Diana mentioned that, and they're available online, and people can get CME even if they watch them online for half of a credit. Or if they join live, they get a full credit. In addition to CME, we're providing CNE moving forward in MOC Part 2 and 4. So there's a lot of incentives built in for education credit.
Dr. Walker, can we clarify the definition of a spoke when it comes to our various health centers that have several clinic sites? The spoke, as defined by ECHO, is each individual site within a health center, correct?
Yes. So in the language of ECHO, we would be the hub at the University of Florida. And this is not our language. This is the language that University of New Mexico developed. So it's a hub and spoke model. We are the hub of diabetes care specialists here. And then the spokes in this model would be health centers, as you said, Diana. But I do want to say, if you are a very large health center, and again, I'll give another example from Community Health Centers of Pinellas. In the initial phase of this, they just engaged their pediatric providers. So that was a spoke. But in the expansion, our goal is to start targeting their adult providers that are at centers we've never worked with before. So they will be 2 spokes in the expansion. So if you have a very large center and you can conceptually divide specific health centers within your umbrella, then we could think about one of your centers joining in February and another center joining in August.
And I'll just add in on top of that, while that might sound like it would make more sense to lump, statistically, the way the study is designed, it actually is better to split. The more individual spokes we generate, the more power the study actually has. So we're happy to have large groups who have sort of obvious ways to cordon off their clinics do that.
Great, and I do see a couple of people are hopping off. So before we let anybody else get off the call, we will continue the discussions, of course, and questions and answers. But before anybody hops off, can we go ahead and do the poll question to see who that is in the call right now is interested in participating or being directly reached out by the UF ECHO team? Steph, are you there?
They're coming in. Do you see them?
There you go. Yes,
responses are coming in. So let's give it some time.
Okay.
We can keep it open, but you all can definitely keep chatting. Sorry.
It's okay. And of course, I think something that I didn't stress enough is that ECHO is free of cost to your health center, and they are incredible at providing support. So even though there is a burden on the side of the clinic, this is definitely a very supportive team that can help you address any issues that you think you might have during that one-on-one session. So even if you're not completely sure, please let us know if you want that one-on-one session with the ECHO team, and they'll be happy to answer any personal concerns that you might have about your health center.
Well, I can go ahead and actually close the poll out. Can you see there?
We like 100% yes. That's good.
That looks great.
Thank you, everyone. You did such a great job, Diana. Everybody's ready.
Yes, we need you for all recruitment.
Well, I don't see any other questions in the chat or anything else, Diana, just to let you know.
Yeah, so if nobody has any further questions, I think we'll just give you some time back to go back to your patients. Thank you so much, Dr. Walker and Dr. Haller, for making it to our information session. I look forward to reporting everybody that's interested in the program.
Thank you.
Thank you.
Thank you.
Bye.
Have a good day. Bye, everyone.
Thank you. Bye-bye.